Hello, friends, and welcome to the April 13th edition of Weekly Witness, Texas Impact's weekly opportunity for mainstream Texans of faith to learn about policy issues here in our great state and have a conversation about how you can engage in that process. My name is Scott Atnip, your host and Texas Impact's Director of Public Witness, and we have an exciting episode for you today as we welcome Jennifer Harris to the program. Jennifer is the Rural and Faith Outreach Lead with the COVID Collaborative. She's got a wealth of knowledge about the pandemic, and we've asked her to talk about where we go from here, both as faith communities and advocates. And we'll also welcome Mark Vassallo, Vice President of Operations at Houston Methodist Hospital, who can talk with us about the toll the pandemic has taken on the Texas public health system. On this week's Watchlist, Josh gives us an update on those mail-in ballot rejection rates from the March primary that we've been seeing so much about in the news. And to kick us off, we'll begin with a weekly word from Reverend Sue Abold, a retired hospital chaplain and longtime Texas Impact board member. But before we get to the program, I want to share a couple of quick thoughts at the top. First, thanks as always to all who've reached out with comments, questions, and suggestions for the podcast. We'd love to hear from you. I'll be looking for your emails at scott@texasimpact.org. And help us out by subscribing, sharing, and inviting a friend to listen. Y'all, this is an episode about a topic we all wish we could stop talking about. COVID has impacted every aspect of our lives for 2 years. I imagine that about every one of us has lost a friend or loved one or know people who've been impacted in meaningful ways. Throughout the preparing for and recording of this episode, I've thought about the loved ones we've lost, and I wish we could just move on. I wish we could all declare mission accomplished, but that usually doesn't work out very well. Jennifer describes our current reality as a pause, and I think we're all praying that the pause is very long. But I think we all know deep down that we need to be mentally preparing for another wave or another pandemic, hopefully years and years from now. As individuals, we have to keep having conversations, especially with our vaccine hesitant friends and family. We have to keep preparing as communities and as a country with policies that protect public health and ensure vulnerable communities are cared for. So I'm with you. I don't want to talk about COVID anymore. But I hope you'll join me in considering what role we might have to play in protecting our families and communities, and take notes on the tools that are available to us. And with that, here we go. The Weekly Word with Reverend Sue Abold.
Hello, my name is Sue Abold, and I'm a retired United Methodist pastor and hospital chaplain. When I was asked to give a short devotional this week on the theme of COVID, I thought about how all of our lives have been disrupted during the last 2 years. We suddenly lost much of what was familiar and routine, things that gave meaning to our lives, jobs, social interactions, worshiping and learning together. They were replaced by being at home, interacting or watching on screens, talking to others only with technology. It was a time of disruption, fear, loneliness, and for many, their own illness or that of loved ones. And for others, it has meant grief and loss. I was not able to work as a chaplain during the pandemic, but I heard from former coworkers and thought about them frequently. The job of hospital chaplain is not one of just religious ritual. In fact, that's very little of what we do. The ministry is primarily one of being with patients and families and hospital staff during times of disruption, fear, loneliness, pain, and grief. In the early days of the pandemic, my friends performed these tasks, sometimes from doorways or by phone, but they were there, and so was God. This led me to think about how, for individuals and families, we encounter our own times of crisis that upends our lives, and how God steps in. I encountered the term thin places a number of years ago. I don't really remember what book it was in, but I have many times been in thin places. They are, in the words of Chaplain Reverend Cindy Hoy, where the distance between heaven and earth is very short, where the holy is encountered in extraordinary ways. Thin places happen when ordinary people brush up against an extraordinary living God. Many times this is in a time of loss, a deathbed where the presence of God is intense and the very air is different. Grace is almost touchable. But it can also be in times of intense joy, such as a birth, news of recovery that wasn't expected, or reunions of estranged family brought together by love for another. It can be, I think, also a time like the pandemic when we come face to face with ourselves and with the one who made us. I am thinking this well this week of the thin places in Jerusalem 1 week, almost 2,000 years ago, of a group of men dedicated but confused about their future and that of their leader, gathered together in an upper room to worship and observe an ancient ritual of faith. And the words of that leader, Jesus, about God's plans for him and for them, of those same men and many others, gathered later to witness 3 men, one of them their Jesus, be put to death. A time of fear and loss, and yet God was there. Many in the crowd could feel that. And 3 days later, when grieving friends went to the tomb and found it empty, God was there. God was there when the grieving friends and family encountered the risen Christ as they gathered later behind closed doors. God is always with us, but it is in those times, these times, when life is upended, disrupted, when we wonder what the future will bring and it's out of our control, that God's presence is shown to us in our thin places. May God's love fill us in all our days.
This week's episode was brought to you by Methodist Healthcare Ministries of South Texas, Friendship West Baptist Church in Dallas, and the COVID Collaborative.
Joining us for today's conversation is Jennifer Harris, the lead for rural and faith outreach with the COVID Collaborative. Jennifer, it's so good to see you again. Thanks for taking the time today.
Absolutely, Scott. Happy to be here.
Before we jump in, why don't you start with telling us about the COVID Collaborative and your role in it?
Sure. The COVID Collaborative is a national organization that has a footprint and some field teams spread across certain states, including Texas. The Collaborative is a diverse and very comprehensive group of experts that spans health and medicine, education, the economy, business, and they're united under the umbrella of fighting COVID. It stood up early in the pandemic, back in the day when PPE was hard to come by and tests were hard to come by and masks were hard to come by.
I remember those days.
Yes, it seems like so long ago, yet it wasn't. At any rate, it's morphed over time, just as the pandemic has changed. Our focus and efforts have changed, and a big part of the work that we are doing now relates to vaccines and vaccine hesitancy and the need for boosters in particular, too, for those who are already vaccinated. And then we're still working across a number of other topics in terms of ensuring that there's access to testing in a continued fashion, weighing in on a global response as far as the U.S.'s role in addressing both, vaccine access and public health measures globally, and then also something, I hope we can touch on later, which is the aspect that's really heart-wrenching for me and for so many people is bereaved children and the young people that have been very directly impacted by this pandemic and by COVID.
Right. Relief to many of us. We've been thinking about COVID for 2 years plus now, I guess. And we're hearing about it less in the news, which seems like a relief, I think, to many of us. I think the question is, should we be comfortable? Is it a mistake to be letting our guard down right now?
I think we can catch our breath. I know I certainly have. At the same time, though, even in spite of what some people might say on social media or in your neighborhood or in your church, COVID and this pandemic isn't over. And I feel like I'm probably, if people are listening or I was sitting in the living room with someone tapping into this podcast, there'd probably be this audible sigh. Much like I remember when I asked the same question, Scott, of Dr. Peter Hotez at the United Methodist Women's Conference back in January.
Right.
Was there going to be another wave? What can we expect in the months ahead? And, he was brutally honest, and I'll kind of steal his message, which I think is unfortunately still true, is that sometime, perhaps late spring or summer or later this year, we will face another surge or another variant. And I think the big question is how serious it is, how virulent it is. And where we're at in terms of vaccinations and other therapeutics and things to, battle this disease and keep people out of the hospital and keep people from dying. But no, it's not over, but it is, I think, a moment where we can pause and have some conversations and some assessments, both at an individual level and a community level and as a country, in terms of where we head next, in terms of what we can do, what didn't work these past 2 years, what did, how can we better prepare for the next wave, or God forbid, but the next pandemic, which at some point down the road will probably happen. And certainly there are lots of lessons to be learned and still learned from what we are dealing with COVID-19.
Well, it is certainly nice to be in this period of a pause, as you called it, and I'll hope and pray that pause is very long. But it's important to remember that that we're in this pause because we have vaccines readily available, and there are enough people who've taken those vaccines. So for those of us who are vaccinated, what should we be thinking about? Should we be thinking about signing up for the next booster shot, or are there other medical advances we can be looking forward to in the weeks and months, years to come?
Well, I think it's amazing to see what science has accomplished these past 2 years. The fact that we do have 3 very good vaccines here in the United States and so many other vaccines around the world that are effective and that are safe. So vaccines, yes, first and foremost, that's a great first line of defense. And I'm certainly heartened. And as somebody that has an autoimmune disorder, I feel better knowing there are also now things like antivirals and therapeutics like monoclonal antibodies that can help with certain variants and obviously with certain types of people or with people with pre-existing conditions and the like, to keep them out of the hospital, to keep them from dying. That's all great news. But certainly I think the attention that we put on vaccines will remain front and center. I think that is, as I said, the best sort of first line of defense. I don't think you should want to necessarily get COVID and trust that the antiviral will take care of it, or that you'll be able to find, a monoclonal antibody that works for that particular variant, or whatever the case may be. I mean, science will no doubt continue to find new treatments and new measures to mitigate COVID-19, and that is great. And I'm hopeful that we'll see more and more of that. But we've got an incredible tool right now with the COVID-19 vaccines that are already out there for both children 5 and up to all the way up to your grandparents and the like.
I will say my 6-year-old was super excited when he was able to get his shot. He was jealous when his older sister got to get it.
You get to, you got that card. You can show it proudly. I think right now, while there's still a segment of the population that's not vaccinated at all, that we hope that through conversations and through education and through some fact-based discussions, we can get that kind of movable middle to a spot to get vaccinated. But I think to your question a moment ago, what can we do to in this pause is making sure that if you are vaccinated, that you have gotten your booster. And in the case of kind of where we're at now, one thing I'd say is always consult with your own doctor or with the CDC in terms of current recommendations. But what we're hearing now is if you had, for example, the Moderna or Pfizer vaccine, you can get a booster shot if it's been at least 5 months after your second dose. And in the case of that Johnson & Johnson vaccine, that's a one-shot vaccine, that you can get a booster shot if it's at least 2 months after your shot. That's very important, I think, in terms of mitigating the next wave and keeping people healthy, because it is still out there amongst us. The other thing that's come up more recently as a result of the Omicron variant is the FDA did authorize a second booster shot, and that's for folks who are over 50 years old. And then for anyone that's 12 and above that is immunocompromised. And you have any questions, I always say, go back to your doctor or the nurse or your physician's assistant, or to, local public health officials as the most reliable and trusted information in terms of the current recommendations. And people have questions too about whether they can mix vaccines or which one they should take if they've had a different kind previously. And all of that, if you have questions or concerns about that, is both a great question for your doctors, but there is some helpful advice that we have put together at COVID Collaborative in conjunction with the Ad Council. And it's a website that is called getvaccineanswers.org, O-R-G. And that website has common sort of frequently asked questions about the current boosters, about the safety of the vaccines, about how they were developed, who's eligible, what vaccines are approved. I mean, pretty much anything under the sun as far as sort of current hot questions and topics. But it also has a vaccine locator, which I think from, here sitting in Austin, I can tell you I could probably walk 2-3 blocks to the nearest CVS or an HEB down the street and get a shot in my arm on demand. But not everybody is maybe perhaps that in the know or in a urban setting where it's that readily or easily available. So getvaccineanswers.org, your own local public health departments and the like are great resources for being able to track down where that vaccine is. And I think when we talk about rural communities in particular, which so much of Texas is rural, it can be a little harder to find that shot and get that shot in your arm. And so that's another resource that we try to provide, is to make it as easy as possible to literally navigate the issue of vaccines.
As people of faith, we are people of hope. And I certainly am in hope that as many Texans as possible are getting this vaccine. It is a gift. Where are we in terms of vaccination status here in Texas, and do you have hope that we can get to an even higher level?
Well, I like that you talk about it in terms of hope, and I am hopeful and optimistic that we can continue to improve our vaccine rates because, to be honest, Texas has lagged, not as much as other states, but I know there's always a sort of friendly competition between us and Florida and between our governors and whatnot. And right now, at least as of April of 2022, when we're recording this, they're beating us in Florida. So let's do our part, Texans, and get more shots in arms. But where we're at, about 64% of Texans are fully vaccinated, according to the Department of State Health Services here in Texas. And another 72% rather, have at least one shot in their arm. So that's good. We can do better, and I'm hopeful we can. How that compares in terms of Texas and nationally? Well, actually, nationally is only about 66% of the population that's fully vaccinated, and 77% that have at least one dose. Again, those are numbers that I think we can improve on, and they have. They've inched up over the past few months. I mean, I'm heartened that it hasn't totally stagnated or stopped. I mean, people are clearly still appreciating or understanding why they need to get this or overcoming their concerns or hesitancy in doing so. Where we're even having a larger gap, though, is boosters. And right now, about 30% of the U.S. population is boosted. So that's a huge number that doesn't have really the full stronger protection that another shot affords you. So again, I think that's why the work of the collaborative will certainly continue, especially as we reach out to those communities where there is greater hesitancy and less vaccine uptake. I mean, I think if you looked at a map, we have these on the COVID Collaborative website at covidcollaborative.us, you can look at county by county and kind of data visualize where things stand here in Texas and nationally. And you can see where those pockets are where, while the state number may be 64% fully vaccinated, there's some areas of the state that are far less than that. So we can do better. And I'm hopeful, as you said, that if we keep having these conversations, that we'll see some more people step up and get the shots in their arms.
My guess is that most of the people who are listening have friends or family who are vaccine hesitant or who, for whatever reason, haven't gotten the shot. I certainly have people in my life. Do you have recommended language or messaging for how we should be talking to people like that, or there suggestions that you have for us?
Sure. One thing, again, I would point everyone to our own website, or the two sites that we have up. The COVID Collaborative's own site has some links to toolkits and some of the PSAs and things that we've done in conjunction with the Ad Council, speaking specifically to the faith community, to minority populations as well, and then to a broader population of adults. I think from a faith perspective, we all know, and just as a Texan, as an American, we know hesitancy is an issue, and it continues to be. Perhaps in some communities and areas more than others, and in different parts of the population. More than anything, I would say, and this is, I think, whoever you're having the conversation with and wherever you're having the conversation with, is to approach things, I think, as calmly and from a place of love and hope that you can. Certainly validate people's concerns. Be open to hearing them out, to actually listening. You may very quickly want to dismiss their concerns or tell them that's not accurate data or information. That's just a way to wall them off and shut things down. So I think validate their concerns, acknowledge that they, are in a place of confusion or concern, and that's completely understandable, and then lead with empathy. I think respect the fact that people have real questions, real concerns. They may be coming at it from different places. A lot of the primary drivers of vaccine hesitancy tends to be around safety or side effects of the vaccines. Sometimes it's just a basis of a lack of knowledge. They're maybe perhaps not as informed, don't work in government or politics or healthcare, and don't have, steady, reliable information, and are mostly basing it off of social media or what they hear from their neighbor 2 doors down. And so I think more than anything is recognizing that there's sort of a range of what hesitancy means, and being able to listen and to understand that different people have different concerns is vitally important. I think also acknowledging how vaccines can impact them as individuals, and what sort of role it plays within their family, within their congregations, within their larger communities, or in our state and our nation, is vitally important as well. But I think having those smaller conversations, like what does this mean in terms of you getting vaccinated, not only the protection it affords you, but what does it do to help your family, your fellow congregation at church, your community as well, to reduce the spread of this disease and keep it from mutating and keep it from having these waves after waves after waves. I would say just use as much of a positive tone as you can, to be very inviting, be very respectful, and acknowledge ultimately that even after this conversation, the choice is still theirs. And, there are always going to be a segment of the population in the world that aren't going to want to get vaccinated. Even before COVID-19, there are plenty of people that are either anti-vaccine or just, very set in not wanting to do that for any variety of reasons, or may have medical reasons why they cannot. But I think at least taking sort of the pause and the time to have these conversations will hopefully move that movable middle, which is what we're really focused on from our work at a rural and faith perspective, and talking with folks that do have hesitancy. It's those folks that maybe if they just had a little bit more information, a sympathetic ear, somebody that they can talk to, maybe it's clergy, maybe it's somebody else in their Sunday school class, maybe it's their neighbor from 2 doors down, whoever that is, or a trusted family member. Just, I think, using this time, this pause again, where we've kind of have an opportunity to catch our breath, and we can kind of ratchet down some of the intensity and the vitriol and the crisis that has surrounded and consumed us in so many different ways, and have sort of a more thoughtful conversation and more fact-based conversation.
Well, it does seem like, and this is me saying this now, it does seem like congregations would be a place where those conversations should be taking place, because the congregation and faith leaders are seen as trusted messengers, and places where we're used to talking about hard things and important topics to better serve our community in the world. And so the theological conversations around this should be real and should provide opportunities for us to talk with each other. Right.
Well, and a huge credit to Texas Impact and your members, in the conversations I've had lately since the United Methodist Women's Conference, which I was privileged to attend and participate in. For me, I have seen you all's commitment to doing the hard work and having the hard conversations and helping your own members, because I don't think, while clergy and lay people can be sort of trusted and loved and respected members of the congregation and of their community, sometimes I realize that, in the conversations that I've had with you all, that even clergy or even lay people have questions or may be a little confused or whatever, and don't know where to begin with these conversations. So that's part of the resources and the toolkits and the messaging that we have and that groups like yours can use in having the conversations, and feeling more confident yourself in talking about these issues and broaching it with people that may be hesitant.
Well, I hope we all spend some time with those documents. Thank you all for compiling all of that. You mentioned at the beginning COVID orphans, and that's a phrase I've been hearing recently that really makes me sad. So talk to us some about those kids.
Yep. COVID orphans. It kind of chokes me up and makes me really sad to even hear that phrase. And I think in my work with the collaborative, while I have been focused so much on vaccines, increasingly as our work has expanded and we've launched this new initiative called Hidden Pain, it's really opened up my eyes, and it breaks my heart to know these numbers. In fact, an estimated 200,000 children in the U.S. have been impacted by the death of a parent or a caregiver due to COVID-19. That's a fairly good estimate. I suspect, if anything, it might be even higher. And certainly as time goes on, if we don't get more people vaccinated and people don't take future waves seriously, that number will only grow. I think that in itself sounds awful, but put another way, that means that roughly 1 in every 360 children has suffered the loss of one or both of their parents. And specifically 15,000 children in the U.S. have been orphaned because of COVID. And it breaks my heart, and it obviously opens up my mind to the fact that there is so much work to be done to help and support these children. Certainly, their mental health and social and emotional health is impacted directly, but, their education and their long-term care in terms of where they live and how they grow up is all impacted and touched by, the loss of one or both of their parents. And so what the Hidden Pain effort is doing is both educating the rest of us who are so fortunate not to have faced a loss like that, as to what the problem is and who all is impacted and what we can do to help and support people. And then also it is a clearinghouse or meeting point to dive into exactly what resources are already available within the social safety net and health and human services and medical communities to help support these children. The website where you can find all this information is hiddenpain.us. And that has our initial report that kind of captured some of the data I touched on, shares some stories of real people and kids that have been impacted by this, and then talks about some of the things and resources that are out there in terms of ways that we can and should support these children in the years to come, because certainly this is not just a matter of getting COVID and being sick for a few weeks. This is a life change for them.
Our listeners do love homework, and so I hope everybody will spend some time at, let me make sure I got this right, hiddenpain.us. Is that right?
Yes.
Okay. So we'll all spend some time there and figure out what we can do about that. Also, speaking of homework, I assume you'll have some on this next question. We are a political or a public policy podcast, and I really do appreciate, I don't say this sarcastically, I really do appreciate how unified Congress seemed to be in the early stages of the pandemic in terms of making sure that there was funding, even if it wasn't always delivered, in a timely manner. There seemed to be this unified vision for at least the direction we should be going. That doesn't seem to be the case anymore. And I know that Congress is currently debating continued COVID funding. What do we need to know about that? Where's the legislation in the process? And what can listeners be doing right now about that?
Well, homework, I kind of hate to give it out, but I like to I like to call it a call to action.
Call to action. All right.
What can you do? I'm not gonna saddle you with a bunch of assignments at the end that you've got to go and check off. No, you should feel empowered and encouraged to do this. I think from the standpoint of where things are in Washington, the polarization and dysfunctionality of government persists to some extent, although I will say in about the past week or so, the U.S. Senate did reach a bipartisan deal to provide an additional $10 billion in COVID-19 assistance. And I like saying a bipartisan deal because you don't really get to say that very often in this modern day age. Yet I will say, but that's also less than half of what the White House and President Biden had originally requested. But the $10 billion, every little bit counts, right, at this point. And I guess, we'll take these small steps where we can. That money will allow the administration and the government to purchase more vaccines and therapeutics, as well as to maintain testing capacity and research for battling COVID. But it did not include $5 billion in additional funding for global COVID-19 aid, which I think is something that we have to be mindful of, is our role in helping support and prevent the spread of this disease or new variants that may ultimately come to our shores. So as a leader in the world, that's something that we should always be mindful of. It also doesn't replenish the program that pays for testing, treating, and vaccinating the uninsured, which, given how many uninsured are in the state of Texas, this should really hit home for people, or, cause people to stand up and want to take notice and maybe say or do something. But also, it just underscores again how much of this pandemic has hit underserved populations, low income, people of color, those traditional populations that may struggle with access to health care and equity issues in other ways. So I think, as far as a call to action or homework, if you will, a couple of things. I mean, obviously, we're heading into an election year. So I think, as voters, educating yourself about where the candidates stand on these type of issues, what they are doing from a standpoint of encouraging vaccination or funding things like the COVID relief assistance that's being moved through Congress right now. I think educating yourself about where your candidates or current office holders stand is important, and encouraging them to see this as an opportunity to assess, but also to be realistic about the wide range of issues we're going to be facing, even as COVID moves from pandemic to endemic, in terms of long-term health care costs because of long COVID, because of the bereaved children and the stresses and strains and things that we will be dealing and supporting them with. And then one other thing, especially on the children and the COVID orphans in particular, on that hiddenpain.us website, if you actually go up to take action up in the upper right corner on the menu bar, there is a page that pulls down that will allow you to send a message to your congressman or senator or both, and let them know that this is something that should be on their radar and that we will at some point need to address in terms of sort of programmatically and policy-wise and funding. Certainly there are existing programs that provide health and human services and social services that these children may be eligible for. But the fact of the matter is there are other aspects of health and human services that may need to be better funded to support these kids, these 200,000 plus kids that have lost one or more parents. So that would probably be the most immediate. If you're feeling like I need to write or make a phone call, Hidden Pain's website gives you some tools and some messaging there to start having those conversations with your elected officials. So while there's not a bill right now to say support XYZ bill number, it is very much something that we want to build support for, both at the state and federal level, is realizing that that is an area, especially with these children that have been orphaned or have lost one parent, that will need to be addressed from a policy and from a financial standpoint.
I usually ask the why question at the beginning of these conversations. And I mean, the why on this one is so clear, right? Like so many people, my guess is everybody who's listening has been impacted by COVID in one way or another, whether it be job related or loss of a family member or loved one. I wonder, and we had a chance to talk at the United Methodist Women's Legislative event, now known as the United Women in Faith Texas Legislative event. We talked about that last week. So I know you're a fellow United Methodist, and I know that your faith informs your work. So I'd love to hear, as we close out today, just some reflections on how your faith has guided you over the course of the past 2 years during this pandemic.
I think it's reminded me again of the importance of community and of what we can do to love and support one another. Because I think you're right. Whether you've had COVID, whether you've had somebody that's been hospitalized with it, whether you've lost a family member or a friend or a coworker, whether you know somebody that's battling long COVID for weeks or months or years now, I think, as you said, there's so many different ways that it's impacted us. And so from my standpoint, the Methodists, kind of with our mantra and tagline of opening hearts and doors, for me, that's where I have sort of sat the past 2 years, certainly very privileged not to have had my work directly impacted. And in fact, to be very blessed to be able to do the work I'm doing now specific to this project, to be able to, have these conversations and work very hard to support those who have struggled or are struggling in terms of COVID, long COVID, job losses, family deaths, disabilities. It's staggering the amount of, I think, trauma and ways that people have been impacted. So I think very much thinking about what you can do, even in the smallest way and smallest acts of kindness and generosity, I think is important. I think we should always, as a faith community, also, as I've looked past these 2 years, view the preservation of life, both of our own lives and the responsibility we have towards others, as being a priority, and obviously very much central to our faith and central to our work in the church and around the church. So I think as faith leaders and as lay people, as you become more comfortable with the science and with the facts and the data surrounding the vaccines or surrounding the current state of the pandemic, is being out there to sort of spread the good word of what is still needed and what must be done in terms of still managing this ever-evolving pandemic. And I think, it kind of goes back to not just my faith and realizing that we should be looking for ways to not only preserve our life, but truly be pro-life in the sense of protecting everyone, no matter their age or status. But I think the other thing for me, just in terms of a simple message to everyone, in terms of homework, going back to that, or a call to action, is get vaccinated, get boosted, and have the conversations, even if it seems tough or insurmountable, with those family members or the coworkers or people in your church that may not be quite there, that may have concerns and may not be vaccinated yet. And I think the last thing I'd say is, Lord, I to be a healthcare worker through all this, the doctors, the nurses, just say thank you and think of some little ways or big ways that you can support those folks who are still very much in the trenches of it. Certainly they're getting to catch their breath a little bit, but it has been, 2 solid years. And essential workers, delivery drivers, clinic staff, grocery store staff, pharmacists. I mean, it's the classic heroes, so many of them don't wear capes. But I think whatever we can do to acknowledge and do some small act of kindness in our own individual way, or collectively start to look at the way these folks are paid or supported, and the way that we can help support them, gosh forbid, if there's another wave or another pandemic down the road.
Well, that seems like a pretty good place to leave it. Jennifer, I'll extend those words of appreciation to you, both for the time today, but also for the work you've been doing over the course of the last couple of years. Thank you for your leadership on this, and thanks for the time today.
Absolutely. Thanks for having me on, Scott.
Next, we'd like to welcome back to the conversation Texas Impact's Advocacy Director, Joshua Houston. Josh, it is that time of year where usually you're trying to get fit for the next legislative session. How's that going so far?
Yeah, legislative sessions are marathons. And by May, if you have not come into session in shape, your body and just your mind really suffer. You have to come into it in pretty good shape to be able to endure it. It's a big marathon.
Well, speaking of marathon, you can be an inspiration to all of us. You're an inspiration to me, Josh. I tried to work out this weekend, started trying to run again, and I think I have a stress fracture in my foot because I overdid it the second week out. So maybe the lesson for all of us is don't work out. I don't know. Probably
maybe
not.
just don't go out too hot.
Maybe that's the problem.
Listen to your body and take it a little slower.
All right. Well, this is not the podcast for workout tips from Scott and Josh, but you can be inspired by him and doing his exercises and not me by overdoing it. So that is not why people tuned in. I think people did tune in this week to hear your watch list for the week. And I think based on our conversations, I can predict that your watch list is going to have to do with the election results that have coming back. And specifically, we spent all last year talking about Senate Bill 1 and other pieces of voter suppression, pieces of legislation. So how's that worked? What do we see in the primary?
Yeah, so right after the primary came out, a lot of news stories broke about a high number of rejected ballots. And so last week, the Secretary of State has released their number of mail-in ballots rejected in the March 1st primary, and it largely confirms that preliminary analysis done by both the AP and the Texas Tribune. Both did pretty good work, and the Secretary of State's number is even higher because it actually is all 254 counties, and that number is 24,363 mail-in ballots that were rejected, which constitutes a rejection rate of 12.4%. So 1 in 8 mail-in ballot voters were disenfranchised and lost their vote.
That seems super high to me, and I assume everybody else listening, but how does that compare with previous elections? I know Texas Impact has done analysis on this.
Yeah, it is super high. So 2 different data points. The U.S. Election Assistance Commission looked at March 2018 and found just under 2% of mail-in ballots were rejected statewide. And that comports completely with an analysis that we did in the summer of 2020. We did just the 30 largest counties, but that's 80% of the state's population. And we did it from March of 2016 through May of 2020. And we found an average rejection rate of 1.62%. So it's right in line with what the U.S. Election Assistance Commission found as well.
Significantly different than 12%.
Yes, 2% compared to 12% is a big difference.
Yeah, so why is that happening?
Well, largely because of Senate Bill 1. The state in Senate Bill 1 required that mail-in ballot voters write an ID number on the carrier envelope and also on their application to vote by mail. So there were problems with the application process, and then there were problems with the ballot itself. And it caused county election administrators a giant headache, and it caused voters not just a giant headache, but it caused them to lose their vote. So they can put, if they have a state ID number, then they're supposed to use it. And if they don't, then they can use the last 4 of their social. The big problem, however, is that 1.9 million voters, so that's about, 1.9 million voters is a big number of people in Texas. They do not have both numbers on file with the state. They had maybe 1 of 2 numbers on file, and they registered years ago. Some of them have lived in the same house since the 60s. My 99-year-old grandfather, for instance. So who knows? They don't remember what number they had on file. And so bad databases, essentially, led to a high number of rejections.
And what kind of people are we talking about here that are being predominantly rejected?
Yeah, because Texas is so restrictive, the vast, overwhelming majority of mail-in ballot voters are senior citizens over 65 and voters with disabilities. So these are mobility impaired voters that have a hard time, going to the polls, and they have to rely on a functioning mail-in ballot system to be able to vote.
Is this something that the legislature should have been aware of, or is this surprising to everybody?
Yeah, not only should they have been aware, they were well aware of the problem. Multiple advocates, I think we testified to this as well, warned that this would be a problem. The most powerful testimony, though, came from the state election administrators themselves. They repeatedly warned the legislature about this. That 1.9 million number came from them. And they testified that voters that only had 1 number on file would not remember which one they had registered with. And that played out exactly like they said it would.
You have talked a lot about what's happened in the past and what you've been seeing coming in, but is there anything you're watching moving forward?
Yeah, the public really needs an answer to this. So we have an official number. That number is 24,363. What's not in that official number is the reasons why. We have some clues. We have a good number of counties who have reported data to the press. So the Texas Tribune has a really good article. You had with specific examples, like in Hays County, all but one of the 208 rejected were due to this ID requirement. El Paso County, 94% were due to this ID requirement. Williamson County, 73% were due to the ID requirement. So we have that kind of specific spot checks. But what we really need is the state of Texas to release officially the reasons why 24,363 were rejected. Because without that data, you can't make policy without reliable data.
Definitely something to watch. We'll all be watching with you, Josh. Thanks for the time today.
All right. Thank you, Scott.
Next, I'd like to welcome to the program Mark Vassallo, Vice President of Operations at Houston Methodist Hospital, who's going to talk with us about the toll the pandemic has taken on the Texas public health system. Mark, thank you so much for joining us today.
Oh, it's my pleasure. Thank you for having me.
So, as somebody who has worked in operations or works in operations for Methodist Hospital, how has COVID impacted the hospital over the last 2 years, and what's the current reality?
Well, I'll tell you, I was pondering that question. It has been an amazing journey over the last 2+ years. This has been, of course, a sea change for us at Houston Methodist and for the entire healthcare community in the world. And one of the reflections we had about this very recently was Houston Methodist history was actually founded from a pandemic. We're actually 102 years old, and our hospital was actually founded during the Spanish flu epidemic and pandemic that affected the United States at the time. Wow. So long history, of course, of responding to disasters and emergencies and that sort of thing. Events like this are watershed moments for any society, and healthcare, of course, was not immune to the effects. I would say that the biggest changes that have occurred in our work culture is it's become one of these a culture of both great pride and great sense of accomplishment, but also a very tired and very worn out sort of a feeling like, the accumulative events of one wave after another really has taken its toll on our workforce, and you become more sensitive to each and every change that occurs. Certainly we've seen incidents of folks with post-traumatic stress disorder. We've seen folks who have had anxiety and distress, over the next case or the next case. But at the same time, we've had these great stories of triumph where people have survived, through both, living through COVID as the illness, and then also the sense of accomplishment that the staff have for having overcome a lot of adversity. There was a story that we actually have recorded of one of our own employees who both she and her husband contracted COVID early in the pandemic. She actually survived and her husband did not.
Oh, wow.
And having to go through both struggling to survive, to fight through the illness, and then also having the realization that her husband, did not survive. The only thing she talks about right now is how supportive the hospital staff and her work family was through all of this. And for her, she considers it a great blessing that she had the opportunity to be cared for by people who loved her and cared for her so much. So even in the midst of a great tragedy, she was thankful and she was felt blessed. That's a really amazing place to be, to be in. So while I would never, if you had your choice, you wish this pandemic would never have happened.
Right.
But there have been amazing tales, okay, of both heroic behavior, of very spiritual behavior, of growth, of community that actually really far surpass a lot of the negatives. So that's kind of on the kind of the emotional side of it. If we were to take it to the operational, sort of tactical, strategic side of it, Houston Methodist has a reputation of being able to handle disasters. I mean, we've gone through many hurricanes and floods, and H1N1 flu epidemic that occurred a few years ago, and even the Ebola scare that we dealt with just right before COVID actually put us in a very good position to be able to handle this pandemic as it came across. We actually created a high infectious disease unit in one of our hospitals to be able to take on patients who would come in with a highly communicable disease, so we could isolate and be able to do the things that we need to do. So we were actually very much prepared, okay, for this sort of a thing to happen. I think the sheer numbers, okay, were more than anybody expected, but the process we were well prepared for. We are, again, good at disaster.
Right.
It's the sustained disaster footprint that we had to hold and still continue to hold. We went through 5 different surges. Many parts of the country only went through 1 or 2,
Right.
but the Houston area went through 5. So it was just one after the other. And again, did a very good job of that, but that's going to take its toll on the workforce, on the supply chain, on the resources, everything that you could think of. How are we now? Today, the most prevalent variant is the BA2 variant. We are seeing that occurring, not at any surge level by any means, but there is still baseline positivity out there. You do see folks coming down with COVID, but having less need for hospitalization. It's becoming more endemic than it is pandemic, meaning that it's going to be something we're going to live with, like the flu.
Right.
Vaccinations are still highly effective, and boosters against the BA2 variant. Some of the oral medications that you can take, like Paxlovid, are effective. So that's good news. I think that the good news is we have systems set up, not just at Houston Methodist, but really across the country, to monitor these variants, monitor their effect, and how the current therapies are going to work against them. And that monitoring system is going to last even beyond this pandemic and into any other potential threats that might come down the road. And that is actually a good footprint. So I'd say we are cautiously optimistic that we will not see another surge to the degree that we saw the Omicron surge. But you always have to be prepared for the worst.
I should have started with the shout out to the heroes at Methodist Hospital and every other health institution around the country. Dr. Boom, your CEO, came on in the fall and talked about the heroic work and the way that Houston Methodist has been leading in this effort. I'll also add, I really resonated with your story about your nurse. My wife is also a nurse and lost a family member, lost her dad to COVID in the midst of this. And so there has certainly been a toll on all of us as humans, but especially those in the healthcare realm. And I wonder, I keep hearing stories and anecdotal evidence of people leaving the profession and hearing about understaffing. How's that going? Are there any patterns you're seeing? Are we out of the woods yet? And I know it's impacting more than just nurses, right?
Well, I think it's a very germane question you're asking. And I think we see in the media all the time the discussion about the great resignation, I think is the new term that they're putting, where a lot of folks in the workforce have decided, and not just in healthcare, but in other parts of the world, is it really worth it for me to be spending time at this job, which I may or may not value, for the amount of money that I'm being paid or for the stress that might be involved? And healthcare has not been immune to that. I would say over the first 3 surges that we had, our turnover rate stayed very stable. And if you'll notice, and again, these opinions are my opinions. Okay.
Right.
I do not study this for a living. I'm an operations executive. So I'm not quoting any studies or any of that sort of thing. This is my experiential, take on this. But during the time of the first 2 or 3 surges, there certainly was a high degree of support for healthcare. And we saw a lot of staff stick with it,
Right.
through that. At the same time, when the 4th and the 5th surge hit, there was a lot more discourse and discord in the media in other places around COVID. A lot of people were getting tired of masking. There was fights about whether vaccination was the right thing to do. Certainly a lot of conspiracy theories about things like the CDC, and the CDC, to be honest, was wishy-washy in some of their decisions. They were making decisions pretty much, weekly that were different, that would change. So that degraded a little bit of confidence. So in the 3rd and 4th waves, and the 5th wave especially, people weren't as gracious to healthcare, as they were before.
Right.
In fact, many caregivers relate stories of taking care of patients who had denied that vaccines were useful, didn't want to be masked, were out in public, not social distancing. And then when they would become sick and actually be needing hospital care, they were demanding treatments that weren't scientifically relevant.
Right.
And this causes a great deal of cognitive dissonance for staff. I mean, I have a duty to care for this individual who absolutely is not caring for themselves in a way that I would agree with.
Or sometimes don't even agree that they have it, right?
Well, there was some of that going on, but once you're in an ICU, on a ventilator, it's pretty sure, you've got it. But in the context of this dissonance, where staff were not feeling a sense of support from even the patients they were being cared for, it became harder for them to stick with it. So our turnover rates actually increased. They peaked at the end of the Omicron surge to the highest levels that they had been in the hospital's recent memory. So we've worked very hard to rebound from that. In fact, over the last month, we've actually cut that turnover rate in half. So it's actually improved quite a bit. And I think that's because we do have a strong sense of our mission, vision, and values, and we have our vision is to have unparalleled safety, quality, service, and innovation. That's kind of the thing we talk about, and we have a process that we call our pathway to unparalleled, which is a time sharing with our staff, where we talk about those values and the mission and our vision and how we realize that in real life. We actually get our staff together in large groups into tables where we'll talk about these things and facilitate conversations about what does it mean to you to have unparalleled safety, or what does it mean to you to have unparalleled service. And we put those aside during the COVID surges because of the heaviness of the work, and we brought those back. And I think the staff are starting to appreciate that. They want to have time to share and to kind of get some of this off of their chest and relate their personal experiences and why they stay, with the organization. And I think that's going to help them to support new folks as they come in. So probably the biggest operational impact of that is we have more new staff than we've probably ever had before that have 1 to 3 years of experience. Those folks that had 3 to 5 years experience are ones that were out migrating, going to other jobs, or resigning altogether. And then the back half, the 10-year plus staff, they're still staying with us. Okay. But they're more experienced and sometimes in different types of jobs. So it's been real important for us to be strong on education, strong on support, and strong on management to help our managers learn how to support and build these new teams. So things are looking up, and I think we'll see this positive trend continue, but it's going to take a lot of support.
During the height of the pandemic, I know many of our listeners and certainly congregations were trying to figure out ways that they could support hospital staff, hospitals. I think people still want to do that, but do you have any recommendations on what listeners or congregations can do to support you all?
Oh, sure, absolutely. And I think one of the hard parts for especially congregations and helping organizations, we had to lock down the hospitals and reduce or eliminate the amount of visitors that we had in the hospitals in order to decrease spread, passive spread of the virus.
For good reason.
Well, hospitals are opening up. You're seeing more visitors to be allowed. Our volunteer services are back up and running in full strength. One of the great things that people can do is to volunteer. Most all hospitals have some form of volunteer services. And they do everything from work in gift shops to go and visiting patients to passing out magazines or books to working in our greeting areas, in our waiting areas to greet patients and families while they're waiting for folks in surgery. These are amazingly helpful, things that we can do. Another thing that folks can do is to get involved in their local hospital foundations. Most all hospitals have some philanthropic foundation, and you do not have to be a rich person, to be involved in a foundation. Every bit helps. We've had people donate $1, or donate $10, and we make sure that every one of those dollars goes directly to helping wherever it is that they think they wanted that to help, wherever those funds they wanted it directed. We've had folks say, "Hey, I'd just like to be able to give $50 for the staff to be able to have a break, and have well, again, make sure that happens."
Right.
But also working in foundation to help with things that the foundation does to either raise awareness or to raise funds or to work in community action. We do many events. Of course, vaccinations have been a huge outward outreach event that we've done, but we do other events as well. Working with the Komen Foundation, with breast cancer awareness is one of the things we do. Heart disease awareness and everything around it. We have a huge transplant program, and so getting folks to sign up to be potential organ donors, is a big thing. So helping in those very tactile ways, I think, is great. But one of the things I when I talk to folks about this, probably the most important thing I think is you're going to be a patient, at some point,
right?
In a clinic, in an emergency room, in a hospital, maybe getting a surgery, or maybe heaven forbid you might become sick and being in a hospital. I think just having some empathy for the process and understanding that you are now, part of what it is that happens inside of a hospital, and to have some awareness of the stress and the work that the folks that are doing the job go through every day. That doesn't mean you shouldn't ask for what you need. You should always ask for what you need, but also understand what's happening, in the meantime. I was actually talking, with my son about this recently, and I was saying that that one of the biggest, things we have to fight against is the image hospital have through the media.
Right.
The media often portrays the very worst things that they can about a hospital. You don't usually hear stories on the nightly news about everything went well at the hospital. No mistakes were made today.
Right.
That you never get that on the news. What you get is the tragedies or the bad events, or, hey, it's a war zone in the ERs in Chicago. And, recently there was a nurse who had made a mistake with a medication, and the local law enforcement decided to charge her with a crime. And she was actually convicted of a crime and has now been sentenced to jail time. Well, that gets on the news, not the hundreds of thousands of times that people have made no mistakes.
Right.
That never gets on the news. So I think, folks, the best advice I can give is don't be swayed by all the negativity. There is a great deal of positive that's going on and wonderful things, that are happening in our healthcare systems. And people who are dedicate their lives to making sure that your stay in the hospital is the most boring thing it can be. No drama, and everything goes just right. That's our goal. And so that's one of the things I think that is important to keep in mind.
Well, Mark, thank you, and thank all of the people at Methodist Hospital and all of the public health, all of the healthcare employees, all of the folks who have really done heroic work over the course of the last 2 years. You all have saved so many lives. I can't thank you enough. So thanks for the time today, but more thanks for the work you do on a daily basis.
Absolutely. Well, it's my pleasure, and thank you for inviting me.
I want to thank our guests today, Reverend Sue Abold, Jennifer Harris, Josh Houston, and Mark Vassallo. But I especially want to thank you for tuning in. Like you, I want to be done with COVID, but the work to protect our communities continues. It can all seem overwhelming, but I hope you can find one call to action this week, one small step that you can take to make a difference. Maybe it's a conversation with a family member or friend about vaccines. Maybe it's a call to your representative about prioritizing public health. But take one step. And then bonus points if you invite a friend to join you. Your community and the world need Texans of faith engaged in this work. So I hope you'll share this important content in this episode with your friends and congregations. And with that, it's time to draw this episode to a close. If you've stayed with us this long, you must have enjoyed the content. So I hope you'll share it with your friends and congregations and leave us a rating or review. That way, even more of your friends can find us and join in the movement for justice in Texas. And y'all, there's a lot going on, so keep an eye on Texas Impact social media for upcoming announcements, or email me at scott@texasimpact.org with questions. And remember, if you appreciate Texas Impact and the Weekly Witness community, please make sure that you and your congregation are members of Texas Impact by going to texasimpact.org. Friends, these are wild times, and 2022 is an important year for democracy, our communities, and the world, as we all work for a day when COVID is no longer a reality. And the faith community has an important role to play in that. The world needs Texans of faith active and engaged. So let's get to work.
Weekly Witness is hosted by Scott Atman, engineered and produced by David Fasalo. Our executive producer is B. Moorhead. The opinions expressed on Weekly Witness are those of Texas Impact and our guests, and do not necessarily reflect the views of our sponsors. Weekly Witness is a product of Texas Impact, people of faith working for justice. Visit us online at texasimpact.org.